Hi there folks, Michael from First Aid Oz once again. In this video we're going to talk about anaphylaxis, and you may have come across or be familiar with what we call an EpiPen, which is effectively an adrenaline shot, which is the treatment for anaphylaxis, or the recommended treatment for anaphylaxis. So some people are aware of what anaphylaxis is. For those who are not, basically it's an allergy. Okay, an allergy which is a severe reaction. Quite often we know of it to be food related. So for example, the stereotypically common ones are nuts and shellfish and those type of things. But these days people are becoming allergic to more and more different things, which can cause an anaphylactic reaction. For those of you who, for example, had a COVID vaccination, and they get you to stay after the injection for 20 minutes or so to see whether you have an anaphylactic reaction to that substance. So there are many things with preservatives in food, with certain chemicals and those type of things that people can have a reaction to. Well, there are many different symptoms with anaphylaxis. Okay, so obviously if the person has been diagnosed as anaphylactic, they would be prescribed an EpiPen, and it's always a good idea to have two. But for the first aider who perhaps is not familiar with the casualty and what conditions they may have, you need to be aware of some of the symptoms. And like I said, there are quite a few, and a few of them will flash up on the screen during this video as well. So the ones that we often associate with anaphylaxis are itchy skin or hives, difficulty breathing, swelling of the airways, gastrointestinal discomfort, sometimes a drop in blood pressure or faintness or lightheadedness, if you like. Lots of different possible reactions. So in regards to the treatment then, what we want to do is we want to inject the EpiPen into the quadriceps, into the meaty part of the thigh. We get the person lying on the floor, okay, nice and comfortable, and we release the safety cap on the end of the EpiPen. We place it on the quadricep, okay, and you'll hear a click, and you click and you hold it for 4 seconds. That allows the medication to go through. Remember, we're not doing it on ourselves, we're doing it on the casualty. If the casualty is conscious, perhaps they'll do it on themselves. However, EpiPen is one of the medications as a first aider you are allowed to administer. Okay, there's two, there's EpiPen and there is the bronchodilator for asthma, usually Ventolin. Okay, so otherwise first aiders are generally not permitted to administer medication unless you're a carer. If you're a full-time carer or a carer and you're overseeing the person's medical regime, if you like, then that's a different situation. But in this case, as a normal first responder, anaphylaxis you can administer. Now, the reason I say that you should have two is because if the symptoms don't improve, okay, 5 minutes later you give a second one, okay? You don't give the same one. This is, once it's been injected, it's done, okay? You keep it, you write their name on it, you write the date, you write the time, okay? And you take this with them to the hospital, like I said, in the hospital. In the case of anaphylaxis, they need to be hospitalised. So you need to make sure somebody has rung 000, but don't go off and ring 000 and then come back and give them their first shot. Give them the first shot first. If you're the only person there, well then you make that call. Or if you've got a smartphone, put it on the ground, 000, put it on speaker, and you can do two things at the same time. Because it is important that they get that shot as soon as possible. Now, there is a possibility with anaphylaxis, with the swelling of the airways and the person becoming unconscious, that if they become unconscious and stop breathing, now we have a situation where we need to do CPR. Okay, so obviously CPR is covered in our other videos, so check out those CPR videos, because one of the situations where you might need to do CPR is as a result of an anaphylactic reaction which causes the person to stop breathing. So it is a life-threatening condition. It can't generally be left untreated. There are on occasions people that only have like a mild reaction and so forth. No two people are the same, but in the case of a severe reaction, it can cause breathing to stop, which of course can cause death. So it is a serious condition. Like I said, the person needs to replace these EpiPens as soon as possible, so don't have a situation where they've used the pens and they go a few days before they get the other one. You need to replace it as quickly as possible. But again, that's their responsibility. As a first aider, your responsibility is to ensure that they get this medication. Meaty part of the quadricep, casually lying on the ground. If the first one doesn't work, try again after 5 minutes. Ambulance should be called as soon as possible around the time of the first injection. If there's more than one person, get them to call the ambulance and while you're doing it or as you're doing it. And we need to get the paramedics there as quickly as possible. The person usually after an anaphylactic reaction is usually under observation for at least 4 hours in hospital. So very important that you don't just leave the person and don't just send them to go themselves. All right, so that's anaphylaxis. Thank you.